Hi, this is Dr. Kim. So this is the part two, the integrative and functional medicine and ADHD. Are there alternatives to Ritalin? Wellbutrin, which is another medication capable of dopamine and norepinephrine modulation, and Ritalin will be compared. At last, we will also look at can Wellbutrin treat ADHD. So we talked about part one, how ADHD and dopamine and norepinephrine modulation is how Ritalin seems to work. Wellbutrin, which is another medication that affects the brain chemicals such as dopamine and norepinephrine, but in a different way. So Ritalin, for example, is a stimulant. That's how we classify it. Wellbutrin is a form of antidepressant, and the dopamine boost of Ritalin is strong, whereas Wellbutrin is considered moderate. Norepinephrine boost is considered moderate, and Wellbutrin also norepinephrine boost is considered moderate. So the big difference appears to be Ritalin has stronger dopamine boost. So and the onset of the dopamine is very fast for Ritalin, which is 30 to 60 minutes, whereas in Wellbutrin, it's slower, 1 to 2 weeks. And for serotonin, Ritalin does not interact with it. Wellbutrin, maybe minimal interaction. So Ritalin in the US is FDA approved for ADHD and works quickly to improve attention and reduce impulsivity, whereas Wellbutrin is approved for depression and smoking cessation in the US, but it is used off-label for ADHD. And those of you who use low-dose naltrexone know that the use of low-dose naltrexone is also a form of off-label use of naltrexone. So what do people really use? So for ADHD relief, I think standard of care is Ritalin, which provides quick and stronger relief of the symptoms. But if you have focus issues and depression and fatigue, Wellbutrin can be something to consider. And then if someone's concerned about stimulant like the hypertension, tachycardia, or is concerned about addiction, then Wellbutrin can be something to consider. So the question then is that if Ritalin works by modulating norepinephrine and dopamine, is it possible that Wellbutrin, which also does same thing, but in a different time period, because we said that Wellbutrin works slower, is it possible? So there's a research study done by Maniton and others, published in 2014, and systematic review of randomized controlled trials of bupropion, which is Wellbutrin in generic name, versus methylphenidate, which is Ritalin, in the treatment of ADHD disorder. So there was 146 subjects, and then they compared the Ritalin versus Wellbutrin. And what they found is that there was no difference between two groups in terms of did it work, people who had side effects, or people who stopped taking the medication because of side effects or different reasons. So the idea that dopamine and norepinephrine is involved in treating ADHD appears to be valid, because you can do it either fast through Ritalin, or you can do it slower through Wellbutrin or bupropion. So I hope you learned something, and if you enjoyed it or learned it, please give me a like and consider subscribing. Thank you.